Becca, thank you very much. Well, this morning we are talking about a new initiative to support new mothers on their breastfeeding journeys. And I'm joined by Dr. Sarah Eriksen, a pediatrician and breastfeeding medicine physician at Cherokee Health. So we are talking about a great new program that you all just recently implemented in order to make breastfeeding more accessible to mothers. Tell us about this new initiative.
Absolutely. Well, for about a year now, we have been seeing breastfeeding moms and babies in our clinic who have challenges, as so many families often do, starting and maintaining breastfeeding throughout their baby's life. And we started hearing pretty consistently that there were problems with access to breast pumps for moms who were having trouble getting the baby to nurse at the breast immediately after their delivery. So we are really passionate about addressing those barriers to people meeting their healthcare goals, and started just asking more questions and figuring out what we needed to do to make breast pumps more accessible to our families.
So what were some of those challenges or barriers that these people were experiencing?
We heard pretty consistently that, so I'll explain the process to you. A patient who has an OBGYN provider needed to have a prescription sent off to a third-party medical equipment company who would then call them to talk to them, receive their information, have them choose the pump, and then mail it to their physical address for them to use once the baby was delivered. But if you think about it, that requires several things. It requires a prescription to make it to the durable medical equipment company. It requires a reliable phone for the patient to answer the phone and be able to communicate with the same language with the person who is calling. And it requires a reliable physical address. So any breakdown in that process could result in a delay or even an inability of a patient who has medical insurance that would normally pay for a breast pump to not be able to get that pump in a timely way.
So you're trying to bypass all of that now. You have these beautiful pumps ready to go.
That's right.
Tell us about this new program.
Yeah, so what we did is, once we started hearing that pretty consistently from our families, we contacted the durable medical equipment company and let them know what we were hearing, and asked them to partner with us to actually have the pumps that were covered by the insurances in our clinic. So patients that qualified could receive them in the clinic on the same day as their visit, without having to receive a phone call, have the physical address, and wait for that process. It also allows us to educate them on how to use the pump, and to take it with them to the hospital, or to use it after the baby was born if there's any problems getting the baby to the breast.
That's absolutely great. Tell us a little bit about the importance, just briefly, of breastfeeding and why access to these pumps is so important.
Absolutely. Well, breastfeeding is unanimously recommended for all major organizations that support the health of moms and babies as the gold standard for infant nutrition. And an amazing study came out recently from the CDC that looked at 10 million babies and found that there was an all-cause mortality reduction of 30% in the first year of life for babies that receive breast milk. It's also extremely important for their moms. Moms that breastfeed even for just 1 month exclusively have a significant reduction in their lifelong cardiovascular disease, which we know is the #1 killer of women.
Wow.
So it matters for both. It matters for the babies and for the moms. So we are really passionate about doing everything we can to make sure that people that want to breastfeed have every ability to do that.
Incredible. Dr. Eriksen, thank you so much for being
You're
with us this
welcome.
morning. If you do have any questions or want more details about this program, you can reach out to Cherokee Health.
Absolutely.
But we really appreciate you being with us. We're going to go ahead and take a short break, and we'll be right back.